Well, look, it's been a brutal year, and we asked a lot of the American people, and for the most part, we got a lot of compliance with the public health measures. People did wear masks. A majority of Americans did wear masks. Small businesses bore a tremendous burden from the shutdowns that were in place. Parents had to homeschool their kids, couldn't go to work. Children were missing class, missing the socialization of being in school. I think now we see a rapidly improving picture. The overall vulnerability of the American public is declining through vaccination. Cases are coming down. There's risk from these new variants, and it may not be a steady decline. We may see a plateauing before we continue to see a decline in cases, but the risk is going down, and I think we need to prescribe a pathway forward where people can start to resume their normal lives safely and give people guidance to do that and not be so prescriptive. I think we need to give people general guidance on what they could be doing in an environment where cases are coming down and vaccinations are going up.
And there's not enough of that now.
I think the guidance that's coming out is very prescriptive in terms of telling people who've been fully vaccinated what they can and can't do. I think the bottom line is that people who've been fully vaccinated are at less risk of contracting COVID, less risk of developing severe symptoms of COVID, and they can go about doing things cautiously and smartly. They should still practice precautions when they're in environments where the virus could be spread. If they can wear masks, wear masks. Try to exercise caution where you can, and try to be careful around people who may be vulnerable to COVID, because you may still be an asymptomatic carrier of the infection. But that's sort of the general guidance that we should be giving people. You can resume activity, just be smart about how you do it. Try to exercise precautions while you can, while we're still in a high prevalent environment, while there's still COVID circulating. Hopefully, as cases come down, I think they will come down. I think the summer is going to be relatively quiescent with respect to infection. You could stop doing that stuff. You can stop wearing masks when you're out in public. You don't need to be as cautious. But right now, people should still be cautious.
And, Doctor, right now, there's not enough vaccine supply to meet the demand. We're all told soon we're going to have the exact opposite problem. But here's the question. Is the administration doing enough to convince skeptical Americans, especially in minority communities, to get vaccinated?
Yeah, I think that the supply is increasing quickly, and I think the bigger issue is going to be demand pretty soon. We're going to have more supply than demand. After we work off the really intense demand that we're seeing right now, particularly from older Americans, I think we're going to see demand start to drop off. We'll get 100 million Americans vaccinated probably by early April. We'll probably get to 125, maybe 150 million Americans vaccinated. But beyond that, it's going to be difficult, and I think we will need to stimulate demand. The issue isn't just hesitancy. The issue is making vaccination accessible to people. And that doesn't just mean opening up vaccination sites in communities that don't have access to health care, but making it easy to get vaccinated. Running clinics where you don't have to sign up, you can just show up. Running clinics 24 hours a day so people who work all day can get vaccinated at night or early in the morning. We need to make the vaccination more accessible to people who might not be able to go online, schedule an appointment, show up at an appointed hour because they might be working, they might be caring for their family. So that's what we need to be doing to get more people vaccinated. Ultimately, we're going to have more supply than demand. I think that after March, I think we're going to see a situation where this is going to become more generally available.
For a whole year of helping us understand, Dr. Gottlieb, thank you so much.
Shepard Smith here. Thanks for watching CNBC on YouTube.